Hello YouTubers, I just wanted to make this quick video about hormone imbalance and quickly cover HCG and progesterone. The truth I present is based upon factual evidence and further supported by extensive scientific and medical studies. Hormone imbalance and pregnancy. For a woman to conceive, a delicate balance between several hormones is necessary. If hormonal imbalance occurs, a woman's ovulation may be disrupted. The hormones in question are progesterone, estrogen, prolactin, LH, FSH, GnRH, DHEA, cortisol, testosterone, and HCG. Pregnancy cannot occur without ovulation. Fortunately, hormone imbalance can be corrected by medications and therapies. Besides, some natural remedies are also worth a try, like use of over-the-counter supplements, improvement of your diet, physical exercise, reduction of stress, getting enough sleep, and reduction of exposure to endocrine disruptors. To claim you have a hormone imbalance without a diagnosis is a futile statement. A hormone imbalance is easily diagnosed with lab work and subjective symptoms. Blood work is easily ordered by the doctor in a physical, medical history, and/or collection of urine and saliva are easily provided by the patient to diagnose a discrepancy in your endocrine function and can be easily corrected. The role of the mother in a pregnancy is to provide nutrients, oxygen, protective environment, warmth, remove waste, and most important, love. The role of the baby in pregnancy is to grow. The role of the placenta, which is an endocrine gland that is only present during pregnancy. This is a temporary organ. It functions as a connection between the mother and the fetus during fetal development. The placenta is the organ that provides the transfer of oxygen and carbon dioxide, as well as nutrients and wastes, between the mother and the fetus. After delivery, the placenta is expelled from the mother's body as part of the afterbirth, and any hormones that were produced by the placenta fade from the mother's bloodstream. Very early in the pregnancy, we see the production of a hormone called HCG. HCG is actually produced by the fertilized egg after it implants in the uterus and helps maintain the corpus luteum during the early stages of pregnancy. We recall the corpus luteum in the structure that remains in the ovary after the egg has been discharged. If the egg is unfertilized, the corpus luteum degenerates and the woman progresses through her normal monthly cycle. HCG signals the corpus luteum to continue progesterone secretion, thereby maintaining the thick lining endometrium of the uterus and providing an area rich in blood vessels in which the zygote can develop. In the later stages of pregnancy, the job of progesterone production is taken over by the placenta. At that time, the corpus luteum along with the ovaries become inactive for the remaining months of the pregnancy. The placenta also produces estrogen. During pregnancy, estrogen serves an additional function, and that is, it helps maintain the pregnancy and prepares the breast for milk production. So that poses the very important question: how do these cryptically pregnant women expect to breastfeed their cryptic babies when it finally decides to come with an undiagnosed and untreated hormone imbalance that they choose to do nothing about? Let's quickly cover progesterone. Progesterone is often referred to as the pregnancy hormone, and for good reason. Without it, women wouldn't be able to carry pregnancy to term. In fact, women wouldn't be able to get pregnant at all. This essential hormone is produced by the ovaries, and it helps your uterus prepare for pregnancy. Here are 6 facts about progesterone levels in pregnancy that women should know. Low progesterone during pregnancy can lead to miscarriage. Low progesterone levels can cause complications during a pregnancy. In early stages, it can be a sign of an ectopic pregnancy or an indication that there is a great risk of miscarriage. If progesterone levels are below 6 milligrams during the 6th gestational week, the pregnancy is usually not viable. Low progesterone levels does not always mean that your pregnancy will end in miscarriage. When suppositories are taken, it is possible to sustain a pregnancy and carry a baby to term. Your doctor will monitor you closely to ensure that the pregnancy is healthy and moving along as normal. Many women have given birth to healthy babies despite starting their pregnancy with low progesterone levels. Suppository and close monitoring can mean a successful and happy pregnancy. So this poses another very important question and a very ignored question. How are these cryptically pregnant women sustaining a pregnancy if they are not actively treating their hormone imbalance? It's very important. With progesterone discrepancies, some women may have no issues getting pregnant, but the placenta is unable to produce the appropriate amount of progesterone to sustain the pregnancy for some reason. Doctors believe that low progesterone may be caused by poor nutrition, stress, lack of exercise. Quick breakdown. The first trimester, you need 9 to 47 milligrams of progesterone. Second trimester, 17 to 147 milligrams. And third trimester, 50 to 200 milligrams is what is normal and healthy. I will include the website here. Progesterone levels change during pregnancy. It gives you the early and late stages, and I will include that in the subject matter of my video. Your hormones are responsible for the thickening of your uterine lining, regulating your menstrual cycle, proper fallopian tube function, responsible for triggering ovulation and implantation of the egg into the uterine wall. These are all things your hormones are responsible for. After the placenta develops, it becomes responsible for maintaining the balance for the remainder of the pregnancy. So a hormone imbalance is only important, really important, during the beginning stages of the first trimester. Enough hormone is needed during conception and then to supply enough to the placenta. This is why a miscarriage due to hormone imbalances usually occurs within the first 10 to 12 weeks or sooner. A few of the top signs and symptoms of hormone imbalance are irregular periods, infertility, premature ovarian failure, recurrent miscarriage, poor egg health, not ovulating, fat gain around stomach area, sluggish metabolism, PMS, swollen breasts, insomnia, unexplained weight gain, headache, lethargy, water retention, bloating, mood swings, intolerance to heat or cold, foggy thinking, incontinence. And it negatively affects reasoning and memory within the brain. Sounds very familiar to a diluted cryptic pregnancy symptoms. Maybe your pregnancy symptoms are just symptoms of a hormone imbalance and nothing more. So this poses the question, if you truly have a hormone imbalance, how are you still having regular periods during your cryptic pregnancy? Or not having several periods a month during your cryptic pregnancy? It's a pretty big question. Let's quickly cover HCG. The hormone HCG is a glycoprotein, meaning that it is composed of both sugar and protein and binds to receptors on the cells. Once bound to the cells, it sends signals to cells across the cell membrane. The hormone isn't produced by all adults. Instead, embryonic cells begin producing HCG shortly after a woman conceives. Once the embryonic cells differentiate into tissue types, the tissues of the placenta take over HCG production. As mentioned previously, the purpose of HCG is to maintain an important temporary maternal endocrine cell group called the corpus luteum. By maintaining the corpus luteum that surrounds the egg, HCG also maintains the lining of the uterus, which is necessary to sustain a pregnancy if an egg is fertilized. By maintaining the uterine lining, HCG provides a place for the embryonic development. The embryo is totally dependent on the uterine lining until the placenta is fully formed, usually during the 4th month of pregnancy, sometimes around the 10th week of pregnancy, after which HCG levels stabilize for the entire pregnancy. There is no action on your part that you can make to change the HCG levels in your body. Although HCG's primary role in pregnancy relates to the developing embryo, it has a separate utility. Physicians can test for HCG levels in blood to monitor the viability of an early pregnancy. And I will be making another video on pregnancy tests and covering HCG and pregnancy tests. I'll probably be making that at the end of the week. I want to briefly cover HCG in twins because so many cryptically pregnant women think they are carrying multiple babies. A lot of them think they're carrying twins or triplets. Your body doesn't produce HCG. It comes purely from your developing baby. As such, if you've become pregnant with twins, each developing child secretes a normal amount of HCG, resulting in a particularly high compared to those observed in a single pregnancy. While HCG levels can vary drastically between individuals, they're typically much higher in twin pregnancies than single pregnancies. If you are truly carrying multiples, even if your HCG was slow to rise, it would still be within a detectable range of 25 milliliters, which is an acceptable level of a standard over-the-counter pregnancy test. So if you truly were cryptically pregnant with twins, you have to be producing some kind of HCG in order for those babies to be growing. If you have twins, you most definitely will have a detectable range of at least 25 milliliters, and that is the acceptable level of a standard over-the-counter pregnancy test. So you would be able, if you were truly pregnant with twins, it would come up on a pregnancy test. Even if it was a very, very faint line, it would still come up. I want to clarify what I mean when I say a real cryptic pregnancy that has little detectable HCG or slow rising HCG. Note that there is no single norm of HCG level, especially in early pregnancy, and HCG levels vary greatly as the pregnancy progresses. Here's the breakdown here. It says HCG of below 5 is considered not pregnant. A level above 25 is usually considered pregnant. And then they have, the standard breakdown. There is a possibility that you can have slow rising HCG levels in early pregnancy and eventually go along to have a normal pregnancy. However, it's important to know that these HCG levels are just relative approximates and varies with each pregnancy. Those actual numbers are not indicators. That is, if you don't show similar numbers, then you are in for pregnancy complications. They just provide a probable hint towards a direction where you are going. For instance, a dropping HCG level indicates a problem, and the numbers that go very high for estimated gestational period also indicate a problem, a molar pregnancy. So then there's some symptoms of slow rising HCG. They mentioned ectopic pregnancy, a blunted ovum. So all of these things are something that need to be diagnosed by a doctor. And something like an ectopic pregnancy can actually result in death. So telling women that they should not go to the doctors because they are cryptically pregnant, they could have an ectopic pregnancy and die. So these are, some really interesting things to consider. We pose the following important questions and often ignored questions. How do cryptically pregnant women expect to breastfeed their cryptic babies when it finally decides to come with an undiagnosed hormone imbalance that they choose to do nothing about? The second question was, how are these cryptically pregnant women sustaining a pregnancy if they are not actively treating their hormone imbalance? And question 2, if you truly have a hormone imbalance, how are you still having regular periods during your cryptic pregnancy or not having several periods a month during your cryptic pregnancy? To conclude, a hormone imbalance is easily diagnosed and treated. For a woman to conceive, a delicate balance between several hormones is necessary. If hormonal imbalance occurs, a woman's ovulation may be disrupted. Progesterone is often referred to as the pregnancy hormone, and for good reason. Without it, women would be unable to carry a pregnancy to term. In fact, women wouldn't be able to get pregnant at all. There is a possibility that you can have slow rising HCG levels in early pregnancy and eventually go on to have a normal pregnancy. A slow-growing baby with an extended gestation caused by hormone imbalance at the time of conception does not happen in reality. Even if hormones were imbalanced at the time of conception, the body either works it out or terminates the pregnancy to save resources. I hope this video helps someone. Next video topic, we will discuss a slow-growing baby and what causes a slow-growing baby, what causes the baby to grow slowly in the womb, other than a hormone imbalance and cryptic pregnancy. So that will be my next video. If you have any questions, please leave them in the comments. Don't forget to thumbs up. And if you want to see more videos, don't forget to subscribe. Thank you, ladies, so much for listening and watching. You guys have a great day. Goodbye.